Back to business. The Health Secretary Matt Hancock has condemned doctors who cast doubt on the effectiveness of the use of statins. He says statin deniers are putting patients' lives at risk. Now, about 8 million of you take statins. We should say 8 million of us, because I did take them until recently. And it can substantially reduce the risk of having a heart attack or stroke by lowering cholesterol in the blood. In a passionate intervention condemning those who peddle what he calls myths about the daily pills, Mr. Hancock said medical evidence shows that statins save lives. I've got Dr. Asim Malhotra, friend of this programme, eminent cardiologist. Are you a denier, Dr. Malhotra?
Not at all, Eamon. Actually, I, first and foremost, as a clinician, as a practicing cardiologist, I've been a qualified doctor now for 18 years. For me, I have a responsibility and duty to my patients and their health and to scientific integrity. So where I come into this particular picture, and I was one of the doctors named in this article, as you know, is suggesting that I'm somebody that's, denying the effectiveness of statins. I mean, that's completely false. In fact, what I advocate is lack of transparency in their prescription. So this is about patient choice. It's about good science. It's about the ethical practice of medicine. Now, I must mention, and I think this is really important and crucial, 2 points. One is, I've had a read through that article, and I must say that it is inaccurate, it is distorted, it is defamatory, and it's misleading. And I will be writing to the Mail on Sunday and also contacting the independent press standards organisation IPSO to call for it to be at least majorly corrected, if not retracted. And on the Matt Hancock issue, what's interesting is I actually met Matt Hancock last week. I was invited to meet him to discuss how we can help curb the epidemic of type 2 diabetes in this country. And he's been, I've had a very good rapport with him. He's been very supportive of my work. He realizes that we have a big problem here, and there's certainly lifestyle issues that we can implement that will help patients reverse the disease and reduce the need for medications. Matt actually messaged me today to tell me that he had no idea that I was linked to this article. So there's some serious question marks about the journalism involved in this particular piece in the Mail on Sunday. But I'm very happy to talk about the evidence around statins and what I advise my patients. I mean, I have prescribed statins and managed thousands of patients taking statins. So I see this up front. I know what the absolute benefits are. I've studied the research. I've published on it.
But you're leaving me confused, Dr. Malhotra. Take them or don't take them, and under what circumstances?
Very good question. So imagine that's the question you're asking me as a patient. Now, if you look at the data, if you have a low risk of heart disease, if you haven't got established heart disease or otherwise relatively healthy, then all of the data, when you look at that data, and this is really indisputable, statins will not prolong your life by 1 day. There is a small...
Really?
Absolutely, and that's indisputable. And most of the people in the world taking statins are in this category.
Excuse me, could I then interrupt? If the idea is you have that history that you're saying, yeah? And in my case, my father died from heart disease at 64, sudden heart attack. But if, say, my cholesterol was high, or higher than it should be, is that not helping me in some way if a statin reduces that? So what you're saying is, look, you're eventually going to die of what your dad died of, very probably, but could I not prolong my life with statins?
Again, a very important, good question. So cholesterol has a role in heart disease, but it's just one of many factors. When you look at cholesterol, you have to look at the total profile. So it may be actually high in terms of your total cholesterol, but your profile may be good. You may have high good cholesterol, which is part of that. Yeah. So we put that into a risk calculator. To explain that further, and you can do this online, most people can actually calculate it online. If you have a more than 20% risk of having a heart attack or stroke in the next 10 years, then there is what we call a mortality benefit. There's a slight benefit in prolonging your life. If you're less than 20% risk, there isn't, irrespective of what your cholesterol is. So I think that's important. Then what I would say to patients is, I would say, listen, this is what the information, the data tells us. There is, and this is an important point, there is probably about a less than 1% chance, Eamon, in that low risk category, say you're less than 20% risk, that it will prevent a non-fatal heart attack or stroke in the next 10 years, but it won't prolong your life by 1 day. Now, you may say, doctor, listen, I'm really worried. My father had heart disease. You know what, the 1 in 100 chance? Okay, I'll take that chance. And that's completely fine. And that's the ethical way of practicing medicine. The downside, and this is where the controversy has really come out, is that is about the side effects. Now, the data that we have used to estimate side effects for many years has come from these drug trials,
Okay.
albeit
Now, I'm
sponsored.
fascinated in
Yes.
this because just to clear up this picture, bring you up to date. Right. So I've had the full scans, everything there is to have, 3D, what's that called? MRI or whatever it is. They
Okay.
have
Oh,
all
great.
that,
Okay.
right? Everything looks fine, right? Everything's all fine.
Oh, wow.
I'll be 60 this year.
Congratulations.
So there's nobody saying
So there's no evidence of any heart disease?
no, right?
Right.
So that seems good.
Interesting.
So if I'm taking statins, what are the side effects? I'm going to say I'm talking about lots of people who may find themselves in
Sure.
my position there. So I think what I'm doing is better safe than sorry.
Sure.
Better have that. Better keep the cholesterol low. What are the side effects? Because I'm gonna ask you this because someone told me about side effects that I'm thinking that's so me. But anyway, tell me what side effects are likely.
Sure. So there's a debate about how prevalent these are. In community studies, up to maybe 30%, even my own experience, will experience some sort of side effect that interferes with the quality of life. So people talk about serious, non-serious. I ask the patient, and I'll talk about what the side effects potentially are. Is this interfering with the quality of your life? If they say no, doc, and clearly there's a benefit for them in the statin, leave them alone. If it is, and you don't know whether it's a statin or not, you can stop the statin, and usually, Eamon, these are reversible. The debilitating side effects are reversible within a few weeks of stopping the statin. Now, I'll come into the non-reversible ones in a minute, but essentially the most common one is fatigue, muscle aches and feeling tired. The other things that we often see, and I've seen many patients like this: joint pain, stomach upset, erectile dysfunction, memory disturbance. These are all relatively common in the people that get side effects.
Oh, this is amazing talking to you. This is absolutely amazing. I want to share this with you, but I please don't want anybody to follow my advice. This is just my story,
Yes.
right? Basically, doctor, I would wake up most days having taken my tablets and I feel like crap, right? And I feel fatigued. I continually forget things, whatever. Somebody said to me recently, "Why are you taking this for? Why are you doing this for?" And I'm thinking, well, I'm prolonging my life. I'm doing this sort of thing. He said, one of the biggest things is forgetfulness on this. Now, I stopped taking these about 2 months ago. Day by day, I feel better. I feel like the old me all over again. And I'm not saying it is. I'm not saying it isn't. I'm just giving you my personal experience of all of this. But does that mean then I've got to keep checking my cholesterol? Do I have to keep balancing that?
To be honest, Eamon, I mean, almost like we're having almost a consultation here, and that's
Yeah.
fine. But the
Yeah.
reality is, if you're almost 60 or you're 60
Yeah.
and you've got no evidence of heart disease, then it is unlikely you're suddenly going to develop significant heart. It means, and I don't know how long were you taking a statin for out of interest?
Probably about 5 years.
Okay, so it's possible it may have had some benefit, but the fact is you had no heart disease to start with.
Well,
and
what my GP said to me recently, he said to me when he looked, he said, your cholesterol's fantastic. He said, I'll take the credit for that with the statin.
Right, okay. Well, listen, if you've got no heart disease now,
Yeah.
you had no heart disease 5 years ago, you had no heart disease 10 years ago, okay? So when you started taking your statin at 55, it's unlikely you had any heart disease there, and therefore at that stage, even then, there was probably no requirement for you to take statins. Interestingly, Eamon, I'm going to throw another sort of slight curveball into this, not to confuse people. I was involved in some original research. In fact, we discussed this, I don't know if you remember, on Sky News a few years ago, where we did analysis of just looking at the elderly. So we know there is an issue, very high cholesterol is associated with heart disease, mainly in middle-aged men. But when you hit 60, and we looked at elderly people over 60, and we looked at cholesterol levels and association with heart disease, we found no association with heart disease, with so-called bad cholesterol over 60, and an inverse association with mortality. In other words, you were less likely to die. And one of the reasons for this is cholesterol is also likely involved in the immune system. Elderly people are more vulnerable to getting infections. So there was some protective effect. And to add to that, trials in statins in people in the elderly over 65 show no reduction in cardiovascular death rates or death, all-cause mortality. So really, in my view, unless you've got heart disease, I think those are the people who benefit the most. And just to put it in perspective, because we don't want to sort of forget about these people because they're high-risk people, the benefits for an individual there, taking a statin for 5 years, if you've had a heart attack, is about 1 in 83 in terms of delaying your death or saving your life, and about 1 in 40 in preventing a heart attack. But the key is this. Patients should know that, because then at least gives them, it's about informed
information
consent.
is power.
Yes,
However,
absolutely.
the health secretary is saying medical evidence show that statins save lives.
Well, That is true in people with established heart
Okay,
disease.
established heart disease. You
And it's,
explained that.
and it's also
Explained
what,
that
and
right.
what's the size of the effect is also
Okay,
important as
okay.
well.
Where does this leave us? Just basically on your advice, if you've got and you're likely to, and you've more than a 20% chance of having heart disease, then by all means take them.
Absolutely.
And if you're below that threshold, you're better off without them.
Absolutely, but it's again informed decision making. And I think the other thing is, if you get side effects, I think have a discussion with your doctor. But what I normally do, I tell GPs who, I get patients with side effects of statins all the time, see them in cardiology clinics. I say, try them off the statin for a few weeks. If they get better, great, you can go on a lower dose, or have a discussion with your GP about whether you really need it.
Yeah.
And that's the way we
See,
should be practicing medicine, Eamon.
It's when the doctor here, you're listening, folks, to Dr. Asim Malhotra, who is a cardiologist, and he is a top man in his field. And he's basically saying, he's talking about these side effects you may get with things like statins. The thing is, doctor, the side effects are so negligible, they're so normal, almost, and they certainly become normal. Oh, Eamon's a bit forgetful, calling you Dr. Smith instead of Dr. Malhotra. I mean, honestly, that would have been so me. I just think, what's that? I've met him 10,000 times, I can't remember his name. It would just be like me. And I really thought, well, this is onset dementia I'm getting here or something. Yeah. And honestly, things have really, really, really improved tremendously since I've stopped taking these. The everyday aches and pains, the fatigue. I mean, I used to blame fatigue on breakfast television and doing those hours, but it still wouldn't go away. And now I feel so much better.
I mean, you've made a really important point there. A lot of what we do in medicine actually should be, at the end of the day, we're all going to die. But we want to have a good quality of life for as long as possible. Yeah. And if your quality of life is impaired and there's something I can do as a doctor to help you, then I will do that.
Yeah, it's great. It's great. Look, listen, we're opening the debate, folks. All we can do is ask you to share your story. I'm just saying, I don't think Dr. Malhotra can be dismissed with what he has to say. The other thing, Doctor, I wanted to say to you was, someone had said to me, what does a statin do? It takes fat, out of the blood system, and it deposits it, takes it out of your arteries, and it deposits it where? The liver, right? Is that true?
Well, no, not exactly.
Do you get a fatty liver?
Cholesterol is essentially synthesized in the liver and it gets released into the bloodstream. So what statins do, they act on an enzyme called HMG reductase, and what that does is it reduces the availability of the cholesterol in the bloodstream. So that's how it works. So it stops the liver from producing so much cholesterol. That's essentially what it does.
But would it make the liver fattier than it would be?
No, not at all. In fact, actually, just one other thing to mention about the so-called irreversible side effects. Now, for many years, statins have been prescribed for 30 years or so. Yeah. We now know in probably about 1%, maybe 1 in 50 people, it causes type 2 diabetes. And that's a condition you want to avoid.
Why does it cause type 2?
We don't know exactly. We don't know the mechanism.
But is that nothing to do with fattiness in the liver then?
Well, don't know. We don't know. But it does do that. So that's another problem, you see. And if you think about this, if you're low risk and you're not going to prolong your life and it's going to give you type 2 diabetes, some patients understandably say, well, what's the point of taking a statin? And that's a fair point.
No, I totally understand that. And since this debate has been going about, I've read that argument. So let me ask you this. If you were then to stop taking statins, would you help or reverse your type 2 diabetes? Or is it too far gone? Once you've got it, you've got it?
No, again, we don't know the definitive answer. Yeah. I've seen some patients myself whose blood glucose gets better when they stop the statin. So yes, I think in theory it should help.
Well, I think this is quite scary that we know what individual medicines do, but we don't know collectively the side effects and when mixed with other things and whether it's good in the long term for us or the short term. But look, folks, the doctor here, it was like an open surgery. If you want to take part in it, you want to talk to us, 0344 499 1000, we'll phone you back. Now, as a doctor, Asim, you will know your Latin, right? You know a bit of Latin.
I did anyway. GCSE Latin, yeah.
Okay. What we're going to do is, it's Who Wants to Be a Millionaire tonight, and there have been 10 million pound questions asked over the years. There's going to be one asked tonight. We don't know if the contestant gets it right or wrong. So, eyes down, doctor, we're going to ask you the following. Here we go. Asim Malhotra, for £1 million. I'm only joking, incidentally, but anyway, let's pretend this. You're going to get nothing from us, not from Talk Radio. But anyway, this was a legit £1 million question on the programme. Asim Malhotra, if you planted the seeds of Quercus rhubarb, what would you grow? Quercus, Quercus rubor, R-O-B-U-R, Quercus rubor. If you planted those seeds, what would you grow? A, trees. B, flowers. C, vegetables. Or D, grain. Trees, flowers, vegetables, grain. A, B, C, or D.
I'm going to have to take a guess here because I have no clue, but I think I'm going to go for D, grain.
Final answer.
Yes.
You have just lost £1 million. The actual answer was A, trees, Quercus rubor. Dr. Masin Malhotra, you're not a millionaire.